you all. Welcome to another edition of Doctor in the House. I'm excited to be here. And my name is Chris Carter. Of course, I'm excited that you are joining me. Remember that you are part of the show, so feel free to send in your questions to Doc that is going to be here with us, and he'll be ready to answer all your questions. Remember that, Doctor in the House is where we bring you expert medical insights to your screen. So you need to relax when it comes to your health, because we are here to help you solve some of those problems. Anyway, today we're going to be looking at a topic that is often ignored until it gets very unbearable and serious, and that is ear infections. So joining on us is an expert in the knowledge, and of course, is no other person than Brigadier General Dr. Obodai, an experienced ENT surgeon and former commander of the 37th Military Hospital, and now serves as the medical director of Roseburg ENT Clinic at East Legon right here. So get your questions ready, because he will be ready to answer them. But before we get into that, hi Doc, how are you?
Good morning. I'm very fine, thank you.
Are you excited to be here?
So very much excited to continue.
It's always exciting talking to you, because after talking to you, I have to now start thinking about, oh my God, is anything wrong with me?
Don't put yourself in trouble.
I don't need to. But then, before we get into the topic, we have some questions that people sent last week that couldn't be answered. So we're just going to go through some of them, and then we can start with today's questions and, focus. So we have some questions here. Kindly ask Dr. Obodai if a surgery can be done for someone using an ear aid to recover full hearing.
Now, because before we put in the hearing aid, that will mean that the hearing has already been assessed, and particularly an irreversible kind of hearing aid. Hearing loss. That's the reason we put in the aid to assist and augment it so you can hear. So it's unlikely you can do surgery to restore an irreversible hearing loss, which is aided by the hearing aid you're using.
Okay, so another one says, please, do you have hearing aids, and how much does it cost?
Oh, I don't have hearing aids. I don't deal in hearing aids. When I do my diagnosis and I'm done with that, I refer you to the acoustica, the hearing aid technician, who actually assesses the hearing and everything, and decides what kind of aid you will need. So I don't particularly deal with ENT surgeons. We refer you to the hearing acoustica. All
right, so the last one here. Good morning, Doc. My name is Emmanuel. In 2015, I had a thunder strike whilst using an earpiece. Since then, I was fine until 3 years ago, when I got persistent sounds in my left ear, and I have visited the hospital several times, and now they say it's tinnitus, and it keeps worsening every now and then. Please, what can I do?
He had lightning strike.
Yes.
Through the...
I think probably he was in the rain or something, and...
That must be a very lucky guy to still be alive.
To still be alive, right?
Yeah. So that will be necessarily, if it's through the hearing aid or earpiece or whatever, it affects the hearing there. Necessarily affects the hearing or the cochlea. So tinnitus, hearing loss, and things like that, even dizziness and all, may be expected. So it depends again on it. If it has to be, just put some treatment on.
So it started 2015, now we're in 2015. So that's like 10 years?
Yeah, that's like 10 years now. And it's getting worse.
Yeah, he says it's getting worse.
So it's right from the base, from the hearing organ, from the cochlea. All right, so it has to be managed. Nobody's going to the inner ear to do any surgery at all.
Okay, so it's just about management right now.
Yeah, if it's heart treatment, we have to still go back for review, get it changed, medications and all that, so we can get to contain it. It's a very difficult thing to treat, I must say. Tinnitus, chronic tinnitus, a very difficult thing to treat.
All right.
Humming, buzzing, whistling, all kinds of noises. And it's difficult. It's debilitating. There are times we even have to now use some physical therapies in trying to drown it. All right. And it happens typically at night when everything is quiet. You're sleeping, everything is quiet. So now you hear it a lot more. So we try to tone it down, get some background music or so to just drown it a little bit, so we can have some.
All right, so Emmanuel, I hope this actually answers your question, and you still need to visit your doctor, or if you can't visit your doctor, you can visit Roseburg ENT Clinic. Now let's get straight into today's topic. We're going to be looking at ear infections and the complications that come up with it. So what exactly are ear infections? Let's start with.
Very well, thanks again. Ear infections basically are to do with the external ear and the middle ear. Now we break the whole ear apparatus into 3 parts. We have the outer ear, starting from the pinna, the lobe you're seeing, through the external canal up to the eardrum. That is external ear. Then we have the middle ear, which is actually filled with space, air, and then has the 3 bones that transmit the sound from the eardrum to the oval window. That is filled with air, and that connects anteriorly to the back of the nose. Exactly, the back of the nose, through the tubus eustachiae, and then communicates also to the mastoid process, the prominence behind the ear. That's the middle ear. Then we have the inner ear, which contains the cochlea, which is the hearing organ, and then the vestibular apparatus, which is the balance.
The cochlea is inside.
It's inside the inner ear.
The organ is inside. Okay.
Nobody sees it. It's in the inner ear.
But the eardrum, would you say it's in the inner?
It's the end of the outer ear.
Okay.
So now, ear infections typically are those to do with the outer ear and the middle ear. Okay, so we have otitis externa and otitis media. Those are the typical. There are other infections that will come in, but basically, ear infections are to do with the otitis externa, external ear infections, and the otitis media, acute and chronic middle ear infections.
So how common are they in Ghana?
Oh, very common. Very. In fact, those are the commonest things you find in the clinic. Middle ear infections, outer ear infections. So even commoner than tonsillitis.
Really?
Yeah.
Wow. All right. So what are the early signs of infections that people?
The ear infections. Pain. Discharge. Hearing loss.
Hearing loss can cause infection. I mean, infections can cause hearing loss.
Yeah, exactly.
Temporary ones.
Temporary ones, exactly. Because some of the middle ear infections get exudates. It's like, I've told you that middle ear is full of air.
Yeah.
If you get an infection through the back of the nose and it gets into the middle ear, sometimes it creates secretions. And it creates so much pressure.
So you mean it can start from your nose?
Yeah. A lot of them start from the nose.
So the ear and the nose and the throat, they all connect. Okay.
Yep, they're connected. So it gets through the middle ear, creates a lot of pressure, and it can create a spontaneous perforation of the eardrum so that the pus or the exudate is released. As soon as that is done, usually a temporary small tear, it can heal. All right, so that is how come a lot of it. And if the tear is big and it continues persistently, it affects the transmission or the vibration, the function of the eardrum. It affects your hearing. So that's how come it affects the hearing. If it's from the external ear and it's full, develops complications with polyps and all that, it obstructs the sound that's getting into the ear. It gives you a conductive hearing loss as well.
Right. So that's when we need to perform that test, right?
There you go. You should know if you're hearing well or not.
Can I hear? Click. Can I hear? All
exactly.
Right.
So those are the basic kind of things there. So pain, typically pain. Pain. I mean, extreme pain.
So is the pain inside or the pain outside?
It's difficult to situate it. You feel it inside. I have pain in my ear. Okay. Now, because pain, even pain from the anterior areas of the ear gets referred in the ear. Somebody who has a pain from the jaw joint may come to you complaining of ear pain. You look into the ear. This ear shouldn't give you any pain. You go on, do your other checks and other tests, and you find out, the pain is even coming from the jaw joint. Or sometimes dental issues also reflect in the ear. So it's a whole holistic kind of examination to understand and situate the complaint so that you'll be able to address it well concerning
So what are some of the causes of infections or these ear infections? Especially in let's start with children first before we get to adults.
Very well. Yes, a lot of the ear infections are from the nasal root, like I said. And for kids, it's easier and commoner because the tube that I was describing, the eustachian tube, in kids, kids, it's wider and shorter. So upper respiratory tract infections, boom, get straight into the ear. All right. So the nose is running. You have a chronic upper respiratory tract infection. It's running, and then it follows up
all the way to the ear
with the ear infection. If it's not treated, then it pushes out either through a spontaneous perforation, pushes out. Then you know you're getting a complication of that middle. So you have viruses, that starts the whole show. And when viruses come in, rhinovirus, whatever it is, upper respiratory tract kind of thing.
So viruses and bacteria.
Virus starts, create the tone, sets the tone, and then super infection of bacteria take over.
Oh.
Yeah.
Okay.
So then, more or less combined.
Yeah.
Upper respiratory tract. Because the organisms in the passages, if I swab your throat, I swab my throat, you find organisms. They are normal commensals, they are there. When they get opportunity, they strike. All right, so getting a rhinovirus infection, for example, in the upper respiratory tract area, sets the tone. Suppression of the immunity, bacteria take over, and then it becomes now a bacterial super-infected infection.
Right. With
all these complications, right in the ear, can give you a spontaneous perforation of the drum, pus flowing out, which must be treated.
Yeah.
If not, we'll come back to the complications and talk about those ones. So there is virus, there is bacteria, and there are viruses. Fungi. That could also affect from the external ear, give you automycosis.
But are there certain people that are, let's say, are at more risk? Say, swimmers. Like I swim, like I try to swim like once a week, but I'm imagining people who actually do it as a profession. Do you think they are more prone to ear infections? Because like sometimes you have to swim without even covering
without
your
any
ear.
plugs. Yes. It's interesting you mentioned that because there's a condition we call the swimmer's ear. Swimmer's ear.
Now you're scaring me.
No. I'll give you the conditions. Don't be scared. I'll give you the conditions. It's a swimmer's ear. And what it means is repeated infections from people who are swimming. Either if you're swimming in the pool, that's a different story.
All right.
The issue will be more to do, either you're reacting to the chlorine.
Okay.
That can give you that trouble. But a swimmer's ear, typically, people who are swimming in dirty water kind of thing, they just jump into it. And you have that condition we call swimmer's ear. That infection getting infected from a polluted, probably water pool that you jumped in. If it were a swimming pool, that is treated. So that's more of you happen to react to probably the chlorine that is used. We've had that as well.
Right.
So difficult, simply plugging the ear when you get into it.
So what about people that are around dust and pollution?
Who are around?
Dust.
Yeah, that will not give you an infection. It will give you other conditions, allergic rhinitis, it will give you allergic pharyngitis. It will not give you...
So what about people that wear earbuds always?
Yeah, you could. If that's... the people who are sitting in customer care, yeah, that's what they do. Okay? Some of them who come with reactions. Okay? So if it gets infected, of course, if you put it in the bath, you're complicating the issue. So you have to get it treated. Give them some time off, get it treated, and then they can go back to the business. But ideally, if you have headphones, it's a lot better than having the earpieces.
Right.
Yeah, because the phone just covers it.
Headphones are way better than the plugs.
Plugs.
Are you guys hearing? Wow.
So because that doesn't interfere with anything in the canal at all.
Yeah.
All right. Because the people who put in the canal, even though it's so customer made, some of them have what they call soft foams at the end so that it doesn't get in contact with the bone.
Yeah.
The inner 2/3 is bone, the outer canal. The outer third is cartilage.
Right.
All right. So it doesn't get in touch to inflict pain from the. Of course, it has to be well made as well. Because you have some cheap ones around. You use it and you get pain in your ear as well. Give you trouble.
So that means you have to invest in good headphones.
You have to get the right things, get it customized so it doesn't give you trouble.
Right. So now let's get into the complications. We talked about the infections and also what can possibly give you some infections and also how to know that, okay, I probably have an infection. Now, let's talk about the complications that come up when people refuse to go to the hospital when these signs start or when the infection has already started. What are some of the complications that can arise when left untreated? Very
well. So, to start with, some of the complications, immediate ones, I'll talk you out. Let me mention them and I'll go through them one by one. Now, it can lead, a complicated, untreated, can lead to a mastoiditis. We have a process at the back there which communicates with the middle ear. If you don't get it treated in good time, it gets into there. For kids, you see reddening of the back of the ear with the ear protruding with tenderness. That's mastoiditis. It can even go on and destroy the bony structure
of the ear.
serious necrotizing infection destroying the bony structure of the ear. We call it cholesteatoma. That's another complication.
So then what happens when they destroy the bony? Does the ear fall?
No, ear. Right in the bony structure. So the ossicles and the areas that connect the middle ear to the mastoid. Because you see, the brain is so close to the ear. It sits right on it.
Close to the ear.
So you could get complications where it actually works through the canals, the vesicular canals and the nerve, and gets into a meningitis. That is the lining of the brain.
Yeah.
You can get autogenic meningitis as a complication of a middle ear infection. The brain is just sitting right above the ear. You could get protracted, cerebral abscess, brain abscess. It is rare, okay, because once you get meningitis, please, you have to run and get it done so that it doesn't complicate. But these are theoretical things that can be particularly the abscess. But you can get autogenic meningitis from a complicated middle ear infection. I've mentioned the mastoiditis. This one here becomes a whole problem that must be dealt with. We are probably going surgery if it is so full of pus.
Wow.
Because that's also another aerated, pneumatized structure, the mastoid, full of air. Now, if the infection gets in, bacteria gets in, it gets so infected, it creates pus in there. The whole place is red, it's protruding, so painful. Probably might have to go in and do a mastoidectomy.
Right.
Open it, drain it, so that you can maintain the consistency of the middle ear.
Right.
If you get the bones destroyed, you might have to come back and do a whole plastic surgery to replace the transmitting ossicles. So why would you get there when you can treat your middle ear infection promptly?
Exactly, when the pain just starts.
Just the pain, discharge, get it sorted out as soon as you can, so you don't even get to discuss any of these complications at all.
Right. So talking about that, trying to sort it out. Some people try to do things at home, DIYs at home, and come up with different concussions.
Not into medication.
Exactly. So how dangerous are some of these concussions? And the last time we spoke about it, that's like the first episode. That's when I first found out that there's a process of putting olive oil into the ear. So what if someone just wakes up and says, "Oh, okay, this is probably an olive oil problem." So everything's olive oil for them. So and they just cook up their own concussions. How dangerous is this?
Okay, very good. Thanks for bringing that one up. Now, it's important to, like I said, get to know what you're dealing with and then treat it appropriately. Commonly in this setup or this scenario where we are at, people just run to the drug shop, pharmacy, and buy a medication.
True.
Some of them don't even know what they're buying. Somebody told them, I used this when I had that. They don't even know what condition they had. So, I used this when I had that. It worked for me, so you can go and try it. All right. So they also go buy, and strangely enough, it gets dispensed, and they go and use it. But now let me just sound a good warning here. There are certain drugs that are toxic to the ear nerve. Now, I will not put certain medications in your ear as eardrops until I've seen and noted that your eardrum is intact. I will not put an ototoxic drop in your ear. But if you get to the pharmacy to buy medications, nobody has seen your ear. Nobody has examined your eardrum. So they dispense, you want to buy it, they sell it to you. If it's an ototoxic medication, you instill it, particularly if you have a perforation. You instill it, it goes right through the outer ear, through the drum, into the middle ear, and it can damage because it's so close to the hearing nerve. So it can damage it. So the kind of things we do, self-medicating, you have to really get it really diagnosed. It's difficult. Some of them are going to the hospital, have to sit for a long time, so they want to just go quick fix. Yeah, but it has its own risks.
Right.
Depending on what you're instilling in the ear. Right. So at best, let's get to understand it, get the right things done, and save ourselves in the end.
Right.
Because some of the complications can be very dangerous.
So I see some questions coming in.
Very well.
We're going to go through the questions. We're going to go through the questions very soon. But what are the best ways to actually prevent, having ear infections, especially for people who have recurring issues?
Yes, there are certain conditions that also predispose. Okay. Excuse me. Immunosuppressed clients. Okay, people living with, immunosuppression, chronic diseases, HIV, diabetes.
Yeah,
it
like
reduces,
lifestyle disease.
yeah, it reduces your immunity. So that one can just give rise to normal commensals blowing up an infection. So now, immediate attention to any adverse thing you find in the ear, particularly, the ear will not just get infected without telling you. It will give you pain. You will know. If it's so bad and it's so chronic with pus, it will discharge. You will know. It will affect your hearing. You will know.
Yeah.
So it's not like the signs come in and then at least you're oblivious of the kind of symptoms and things, so you don't know what to do. It tells you. I mean, who will not, tell that he has a pain or not?
Yeah.
So you will know it.
Yeah.
It will not hide at all.
Right.
So you will know you have pain. You know your ear is discharging. You know definitely it's affecting your hearing.
Yeah.
So we delay a lot.
Yeah.
That's what we do.
Yeah.
We delay a lot.
So the main thing is when you feel something, just come to the hospital.
Get it sorted out.
All right, so let's get straight into
and get it sorted out appropriately.
Yeah.
It's the right people.
Right. So there's some questions here already. Kindly ask the doctor, whenever I'm eating, I hear the sound of chewing. And also, I was once told of talking loudly whenever I'm talking. It's kind of like I don't hear myself talking loud or low tone. Do I have a problem with my ear?
Yeah, you're not hearing well.
You're not hearing well?
Yeah, if you have to shout to hear yourself, then you're not hearing well. As I'm talking to you now, I can hear myself. I've not raised my voice at all. I deal with people, some patients who have hearing difficulties. So I know how to raise the decibel. I'm talking to you normal. Oh, can you hear me? Oh, can you hear me? I know how to raise it. So depending on how I operate, I know the level of your hearing. So now if you yourself having to raise it to hear people are telling you you're shouting, then you know
you need to
there's a difficulty. You have to go check it out.
Yeah. So sometimes, is this the one that maybe you can wash the ear? Is this?
Yeah, sometimes it's just obstruction.
Yeah. Don't be scared.
Full of debris, sometimes just obstruction.
Right.
So that it has to actually be well diagnosed.
Yeah.
If it's just obstruction.
I had to put it out there so you're not scared. And
so that you put him at peace.
Yeah, like I'm deaf. You're not deaf. You
That's
just
fine.
need to go to the hospital. Sometimes it's just a little obstruction.
Sometimes just a little obstruction.
All right. So good morning, doctor. I'm from Nigeria. Please, what can I do, doctor? Always my ear sounds like doom, like something is blocking it, and there's nothing. Thank you.
The ear sounds like doom.
Like there's something blocking him.
And he gets it checked, and there's nothing.
No, I don't think he has checked. He said, and there's nothing. So probably maybe he checked with his hand or something. I don't know. But
there's no way you can check your canal with your ear, wrong with your hand. It has to be looked into. You see, it's a very small canal. All right? This is why we use light. We have to get it and look right in there, okay, so we can see. If we just pull somebody's ear and want to look with the naked eye, you don't see anything.
Yeah.
The outer ear, you might see the end, but right through to the eardrum, you will not see.
Right.
So it has to be properly looked at and then well diagnosed to be able to situate it.
All right, so another one from Nigeria, from Kaduna, Nigeria. Good morning, General. Please, someone slapped my boy long time ago. Now, he can hardly hear with his left ear. Please, what is the way out? I mentioned slap last week. Okay? If he was slapped and is not hearing now, the likeliest thing is that the eardrum has been ruptured. Oh. So slapping can do that?
Oh, yes. Full slap onto the earlobe creates a lot of pressure. Yeah. And the canal, like I said, it's a cul-de-sac.
Yes.
The end of the canal is the eardrum.
And the eardrum is
so
thin.
The pressure, is it a membrane?
Yeah.
It's not even as thick as skin.
It's very
a membrane. So the pressure on the lobe, blunt injury, it's not just slap. Sometimes football hits you right on the ear.
Hey.
The pressure transmits it, ruptures the eardrum. If it's so big, it retracts. That perforation is permanent, and it gets infected.
Can anything happen?
You have to do surgery.
At that point?
You have to be long division, do surgery.
At that
point. At that point, you have to treat it, so prevent infection, assess it. If it's a very minor tear from the slap, it has a good chance of healing
back.
Yeah.
All right, so at this point, the person said it happened a long time ago.
If it happened a long time ago, it's likely it's a permanent perforation,
so what
retracted.
happens at this point? Do we need a...
we'll have to assess, see whether he has a good chance of getting, what do you call it?
An aid.
Surgery done, not an aid.
Yeah.
The canal, the drum is perforated.
Right.
You put in an aid, no use. Because the
Yeah, it's flappy right now.
Membrane that will vibrate is not there.
Right.
Okay, so you have to now create a new membrane to do a surgery, tympanoplasty, to restore the patency.
Right. So good morning, Doc. I have been hearing ringings on my ear, on my right ear.
In the ear.
Yeah. Yes. And I have been to the ENT for months, but still nothing. I think it's a tinnitus.
The same tinnitus.
Yes,
right.
Tinnitus. Yeah.
The same tinnitus.
And good morning, Doc. Can having a TMJ disorder lead to hearing loss? I don't know what TMJ disorder is, but
it's a temporomandibular joint.
Right.
It's a jaw joint.
Oh, okay.
Okay, the temple, the mandible. So the temporomandibular joint, that's the TMJ.
Yeah.
Now, it will not lead to a hearing loss. It will lead to otalgia, pain in the ear.
Yeah.
Okay, the pain, like I said earlier, the pain from the jaw joint is a ball and socket joint. So the pain, if there's an infection there, it gives you TMJ syndrome. And it gives you pain, which refers in the ear, but not hearing loss. Right. That would not give you a hearing difficulty.
Right. All right, so thank you, Doc. For those who have just sent in their questions, we can't take your questions right now, but do well to tune in next week, and then we will answer all those questions before we get into the next topic. So, Doc, before I let you go, what's the tip of the day?
The tip of the day, I'll put it out this way. Let's pay attention to our ears, very sensitive. And then when we have the issues I've just mentioned and described right now, pain, discharge, hearing difficulty, let's please attend to them so we don't even migrate into the areas of complications that can result from these infections.
All right. Thank you so much. Where can people reach out to you?
Yes. I can be found at the Rosbeck ENT Clinic at East Legon on the Trinity Avenue. The numbers to call, you can call my number 0244 380 380.
Okay.
I repeat that, 0244 380 380. 380 sorry.
Yeah.
Or 054 772 219.
Right.
That's the main number to call.
Okay.
054 772 219.
All right.
And you reach the Rosbeck ENT Clinic, East Legon.
All right. Thank you so much. Thank you so much. It was really nice having this discussion with you,
Doc.
Thank
you very much.
And ladies and gentlemen, we've been talking about infections and complications, and I just want to let you know that when you feel the pain, when you feel a discharge, all you need to do is get to the hospital. Don't wait for it to get into a complicated state. And I'm sure you heard all this, and yeah, the urgency is important. All right, so we've been speaking to Brigadier Dr. General Ni Obodai, who's an experienced ENT surgeon and also serves as the medical director of Rosbeck ENT Clinic at East Legon. It's been a great conversation, and thank you to each and everyone that sent their messages. Next week, we will be replying those messages that haven't been read. But thank you, and I hope to see you on the next episode of Doctor in the House. Catch you next time. Bye.